Okay, welcome everybody. So today we're going to learn about the main artery that feeds the penile tissue for achieving or maintaining an erection or getting an erection that is rigid. So to do that, we're going to first look at this artery right here, the dorsal artery of the penis, which is fed by the internal pudendal artery right here. You'll notice that this artery comes out from underneath the pubic bone, so it's between the shaft of the penis and the pubic bone. To find the pubic bone on yourself, you can just run down from the belly button. Should be the first bony prominence that's all the way down in that area. You'll notice that here are the abdominal structures attaching to the pubic bone. So this is the front side of the blood flow to the penis. Now the question is, where does this internal pudendal artery come from? To get there, we will go to the back side of the individual. So what you can see underneath the skin, of course, is the uh, gluteal shape. But if we get rid of that and come over here on the left side, you'll see here's the pelvic floor, the iliococcygeus portion of the levator ani, and then here's the coccygeus above that. And you'll notice that there's an artery here, and this is actually the internal pudendal artery. And that is why when you're doing shockwave treatments from a medical professional or medically supervised shockwave treatments, or just doing soft tissue mobilization, this is where you may be directed to perform some of that soft tissue work because the internal pudendal artery could be getting constricted by these muscles or fascia. So after it comes out from there, and I'll also note the tailbone and the sit bone. That is where that soft tissue lies. So you know where the tailbone is kind of instinctively, and then the sit bone, of course, you sit on and feel consistently throughout the day. So after it comes from between there, the internal pudendal artery is going to run through this muscle, which is between the bulb of the penis and the anus. So here's the bulbous portion of the penis and the anus. And this muscle will lie deep to the perineal membrane. So I'm going to get rid of that. And this muscle right here is the deep transverse perineal muscle, which leads to the dorsal artery of the penis. So you can imagine if this muscle is stiff or not allowing this artery to have a free flow of traffic, how that's going to affect a man's ability to have an erection or to even to maintain an erection. And that's also why if you're getting shockwave therapy or soft tissue work, sometimes the soft tissue work, if it's internal, will address this deep transverse perineal muscle, or the shockwave therapy will be directed to be performed between the anus and the bulb of the penis. Now we'll go back to the front side just to review the landmarks that are important. So soft tissue work below the pubic bone, where this artery comes out from between the shaft of the penis and the pubic bone. Also soft tissue work along the abdominal wall where it attaches to the pubic bone would also be helpful, just because that fascia runs farther down towards the penis. And then, of course, on the back side between the tailbone and the sit bone, where that artery runs down and then eventually joins through the deep transverse perineal muscle to come to the top side or back side of the penis. So that is the pathway that the internal pudendal artery takes for the penis to achieve an erection.